I'm proud to be a nurse because to me it is one of the best careers out there. Honestly, I was always drawn to helping people. I helped take care of my grandparents when I was a kid, and I was just always drawn to healthcare needs. I knew in high school right away that I was going to go into nursing field, so I always focused on science and math, and I feel fortunate to be very happy with what I do. Well, I'm from Dubuque actually, so born and raised here. Moved away for college for a little bit, but came back to my hometown to practice. I went to the University of Iowa for my undergrad for nursing, and then I went to Creighton University for my doctorate in nursing. I personally work in family medicine, so I am a family medicine nurse practitioner and work with all age groups. I see acute visits, I see well-child visits, adult physicals, so both preventive exams and also acute exams. My background is pediatric nursing, so my favorite population would be kids and infants. They are so much fun. My approach to practicing would be being a team with my patient. So I really feel like, whether it's a team with the family, a team with the patient, I think that you should collaborate because every patient's different, and so something might not work for them that works for someone else. What drew me to UnityPoint was the people that work there, from the nurses to the doctors. I just felt like they all collaborate really well together. The staff I work with is great with the patients. They go above and beyond every day, so I feel very fortunate to work with such a great staff. I feel fortunate that I'm able to work in the community that I grew up in and serve the community I grew up in. I think it's a great place to raise your family. That's why, I knew right away I would come back to Dubuque because I want to raise my kids here. So I have 2 kids, a 2.5-year-old and a 8-month-old, both girls, so they keep me extra busy. So this is Rosalie, we call her Rosie, she's 2.5, and Lila, she looks really little in this picture, but she's now 8 months. Well, Rosie is very wild for being a first child. She's a handful, and Lila is very laid back, and I'm hoping it stays that way. We like to stay really busy. We love going to see new places, so whether it's going outside, going hiking, going on the river, we really enjoy that. So I grew up going on the river all the time, so I love getting out. Anything that overlooks the river. I always joke around I want to build a house that overlooks the river. Something that some people don't know, I'm a total bookworm. So I read every night before I go to bed. I'm not big into television. I love to read and always have. Growing up, Harry Potter is probably still my favorite series just because I grew up with the series. Otherwise, I like mystery, I like thrillers, I like any kind of funny book. I love what I do because I find it so rewarding. I go home and feel really good about my day. What I want patients to know about me is that I truly care. I really do feel like as a provider you should give your all to your patients just because that's what I expect when I'm the patient. So I do feel like overall patients should know that at the end of the day I do really care.